So there are just a few other bits. I just wanted to basically jump on and do a quick tutorial on essentially how your spine is involved with your balance. So when we look at balance, this concept was taught to me by a gentleman called Dan Murphy. He works over in America. He's actually a tutor at one of the universities of America, Life West, and he talked about this at one of the seminars that I went to this year, and it starts to help us understand why, if we start to have problems with our spine, that potentially our risk of fall starts to go up. And so this kind of a topic is really important, not just with the younger ages, but with the elderly population as well, because if our balance starts to go, actually the risk of mortality starts to drastically increase. So when we look at balance, essentially we've got three areas, and this is really where chiropractic comes in, is that when we look at the third one. So we've got two areas that are systemic. So when we look at balance, there are three things that are going to control our balance: our eyes, our ears, and our spine. And all of those work as sensors, as sending information back into the brain. And so these sensors are essentially going to tell our brain where we are actually positioned. So say, for example, if you tried to balance on one leg and you were looking straight ahead, you would use your eye fixation point to tell you if you're tipping to the left or the right. Okay? Now, what our brain essentially needs, it needs at least two of these areas working properly in order for balance to occur. So let me just take for an example. If we were standing on one leg staring at a wall, we've both got our ears and our eyes that are still functional, and so therefore our balance will still remain engaged. Now, say for example, I asked you to now balance on one leg, but do it with your eyes closed. Now, for a lot of people, if they try to stand on one leg and they do it with their eyes closed, all of a sudden this is going to become a lot more complicated. Now, the reason being is that we've taken out the eyes from the balance receptor. So essentially now we're reliant on the other two. We can only use our ears and our spine. Now, if one of those two is not actually functioning properly, what will start to happen is, as a result of taking one away, if the spine isn't working properly, we're then 100% reliant on the ears. And essentially, like I said, our brain really struggles to only cope with one area. Now, the reason that we know that this is to be true is if you take, for example, someone who is blind, they do not have any of the eye input to the balance. And so they're solely reliant on the other two. Now, say, for example, if a blind person then had damage to their ears, what they would then start to suffer with is serious issues with their balance, because then they're 100% reliant on what's going on with the spine. So what we basically know is that if the spine is not moving properly, essentially what it starts to do is creates issues with the sensory input. Now, there are two areas in the spine that we know are the main two areas. It's the very lower part of the back and the top. So when your chiropractor starts to look at actually adjusting the spine, if these two areas are not moving properly, then what we know is that the brain can actually start to get affected and people's balance can start to deteriorate. There's actually been studies done which show that actually even after the first adjustment, people's imbalance can actually straight away improve. However, it's about the consistency of keeping that movement. So this isn't just about what chiropractors can do. People also have to train this as well, because what we can do is actually by moving the spine, we can actually improve that information or that proprioceptive input going into the brain, so that the brain can actually start to understand where we are as far as positioning is concerned, and therefore reduce the risks of falls. Now, for many people, especially younger people, the risk of falls isn't actually going to be that drastically high. However, this input system is still greatly needed for anyone that's performing any exercise, for anybody that's basically sitting at a desk, because our brain actually needs to understand where we are as far as position is concerned. So regardless of whether you're sitting in a chair or doing exercise, if your brain isn't 100% aware of where your body is positioned, that basically runs the risk of every time that you do a movement, say for example if you're doing a clean and press or a bent over and lift, or even going from a sitting to standing position, your brain doesn't understand where the joints are positioned. What we can do is over or underactivate certain muscles and actually start to create whiplashes in our joints. And this is where the degeneration process starts to occur. So realistically, the easiest way for us to make sure that our brain is getting the feedback from all three areas, one, obviously to look after. This is something that you're probably going to look at with your opticians. If there are any problems with your eyes, then obviously you need to have the most adequate glasses fitted so that you can actually utilise those. The ears is not necessarily about hearing. It's more to do with the vestibular system. So if ever you get any infections or anything like that in the inner ear, it's quite common for people to actually feel dizziness as well. But this one is really kind of out of our control. The one that we can control the most is always going to be this one. Okay. Now, like I say, we only need to have one of the other two. So long as one of these other two is working, we should always be able to maintain balance. Guys, hopefully you find this helpful. If you want to learn more about what kinds of things you can do to improve the mobility of your spine and actually increase proprioception and improve your balance, please just comment below.